Now, from WYDC TV, this is Big Fox News at 10.
Tonight, we're getting a glimpse about the true number of COVID deaths in New York. Yesterday, Governor Hochul added 12,000 COVID deaths to the state tally that was previously unreported. Big Fox's Matt Kleindienst joins us from Corning with the latest.
Good evening, Lauren. Governor Hochul took steps to increase transparency in Albany by updating New York's COVID casualties. The report revealed thousands of COVID deaths that were left unaccounted for. Yesterday, Governor Hochul revealed that COVID's death toll was higher than previously reported in the state. In total, about 12,000 COVID deaths were left unaccounted for by the Cuomo administration. New York's COVID death toll now sits at over 55,000 people, meaning over 20% of deaths were previously uncounted. I reached out to the Department of Health for an interview regarding the additional COVID deaths. In an email, a spokesman with the Department of Health explained that COVID deaths were initially counted from hospitals, nursing homes, and adult care facilities. However, the tally excluded people who died from COVID at home, in hospice, in prisons, and in state-run homes for people with disabilities. The tally also excluded people who died from unconfirmed COVID cases. I reached out to the governor's office for further comment about the numbers, but have not heard back at this time. As a result of the report, members from both parties have called on Hochul to fire Health Commissioner Howard Zucker. Matt Kleindienst, Big Fox, WYDC in Corning.
Rite Aid is teaming up with the U.S. Department of Health and New York State to launch a back-to-school COVID testing program. The program is designed to give easy access to COVID tests for kids, especially ones who can't get vaccinated. To participate, students must pre-register and schedule a test before returning to school. The testing is voluntary and will be provided at no cost to families or school districts. There are 115 Rite Aid locations throughout the state. A Steuben County corrections officer was charged today on counts of grand larceny. Chris Kester was convicted of stealing $2,500 from the Bath Ambulance Corporation while he was still president. Kester entered a plea deal and is being forced to pay back the stolen money. Kester is still employed with the Steuben County Sheriff's Office. Teenagers are being hit hard by COVID right now. According to the Centers for Disease Control and Prevention, the highest rate of infection last week was among 16 and 17-year-olds. That's a shift from the past month, where 18 to 29-year-olds accounted for the highest rate. 12 to 15-year-olds and people in their 30s showed rates just slightly lower than 16 and 17-year-olds. Adults 75 and older reported the lowest rate, at a bit more than a third that of older teens. Overall, 18 to 29-year-olds still make up the largest share of COVID infections, with 6.7 million since the pandemic began. Delta Airlines announced unvaccinated employees will be paying $200 more per month for insurance coverage. Sydney Glenn spoke with a group of medical insurance specialists to see if this could become a new trend.
The president of BlackRock Benefits says he believes other companies who utilize self-funded health plans will follow suit. He says there's also speculation that larger insurance companies may start charging this type of premium as well. The battle over COVID-19 vaccines continues. Attorney Spencer Phillips says this conversation at the workplace is far from over.
I definitely think we're going to see the obligation or the mandated vaccines continue to rise.
Some companies are requiring the shots, and now Delta Airlines is charging those who don't want it.
From the company's perspective, I can just see the financial side that, yeah, ultimately it's going to potentially cost the company and the carriers more. And ultimately that hits the employee's pocketbook and the employers, raises everyone's premium, and unfortunately we all kind of pay for that.
The president of BlackRock Benefits says companies who use self-funded insurance are paying a lot for COVID-19 hospital stays and those who have lasting medical effects of the coronavirus. That's why he wouldn't be surprised for more companies to follow the airline's lead.
Ultimately, it affects everyone in the pocketbook, whether it's through more costs through premiums. So either your employer has to pay more, which makes it so, there's less money to go around for raises, for other types of things. So it's a big deal with companies and their employees.
Phillips says this is all legal, mandating vaccines, offering incentives, or penalties.
Businesses have free rein. If they want to charge extra money for certain kinds of, increased risk, which might be the situation with Delta, they're able to do so and tie it to insurance.
Phillips says in most cases, employers have an obligation to accommodate those with either a religious exemption or disability that would prevent them from getting the COVID-19 vaccine. In Salt Lake City, Sydney Glenn, Fox 13 News, Utah.
Outside of Kabul's international airport, tensions are rising, and time is running out for people to escape the country by the August 31st deadline. Britt Conway has more on whether that deadline is feasible and what happens next.
The wait, the fear, the exhaustion, the desperation. Emotions running high at Kabul International Airport. This is the moment they're all waiting for, hoping for. In just 24 hours between Tuesday and Wednesday, about 19,000 people were evacuated. And more than 82,000 have been flown out of Kabul since August 14th. But there are at least 500 and maybe as many as 1,500 Americans waiting to get out, not to mention Afghan allies. But U.S. troops are set to leave August 31st.
I don't see how we can get out what I think is a higher number of American citizens. Not to mention the Afghan interpreters.
The Secretary of State says he believes it can be done.
We're on track to complete our mission by August 31st, provided the Taliban continue to cooperate and there are no disruptions to this effort.
But disruption is already happening. There are reports the Taliban is blocking Afghans from the airport. And a U.S. defense official says an attack by ISIS-K, a sworn enemy of the Taliban, is a very real threat.
We're operating in a hostile environment.
Contingency plans are in the works and the possibility of continued efforts even after the official operation ends. After that, for the future of this country in chaos.
That intense diplomatic work is ongoing.
I'm Britt Conway reporting.
Donald Trump is facing a lawsuit for his role in the January 6th insurrection. 7 Capitol Police officers are suing the former president, Stop the Steal rally organizers, and members of far-right extremist groups. According to the lawsuit, the officers were assaulted, spat on, tear-gassed, bear-sprayed, subjected to racial slurs, and feared for their lives. They say the defendants spread false claims of election fraud and incited violence against those who were meant to protect them. More than 140 officers were injured. The lawsuit named extremist groups the Proud Boys and Oath Keepers. It's the centerpiece of the Hudson Yards development in New York City, the vessel sculpture. But now some community board leaders are calling for barriers to be installed around it or for the structure's walkway to be closed to the public. The call comes after at least 4 people, including a 14-year-old boy, took their own lives by jumping off the structure.
Well, there are 2 choices now. Either you raise the height of the barriers or you close the vessel permanently. Those are the only 2 options at this point. Nothing else is going to work.
The vessel has been temporarily closed following the latest death while officials evaluate. A 19-year-old pilot trying to make flying history landed at New York City's John F. Kennedy International Airport today. Zara Rutherford, who hails from Belgium, flew out of her home country on August 18th. On her quest to become the youngest woman to fly solo around the world. On her website, Rutherford says the goal of her flight is to close the gender gap in aviation and to encourage girls and women to follow their dreams. The 19-year-old's plan is to fly to 52 countries across 5 continents. The trip is expected to last 3 months. USF Health in Tampa is working with a local tech startup to make virtual training a reality. Catherine Hawley takes a look at the technology which could help expand medical training.
The USF Health Center for Advanced Medical Learning and Simulation is dedicated to training healthcare professionals, providing realistic simulations that can replicate nearly any clinical situation.
I think especially with COVID, we've been pushed to sort of investigate how else can we do training, especially for difficult procedures or rarely seen procedures, and how can we do that effectively.
For the last few years, USF Health Camels has been collaborating with Immertech, a Tampa startup pushing the boundaries on how virtual reality can be used for medical training. Right now, if healthcare professionals or medical residents need to train remotely, videos and video conferencing are the only options. Using this VR technology will give the user a more immersive experience, like they're actually in the room. Trainees wear a VR headset, Cameras allow them to observe surgical procedures and even ask questions, no matter where they're located.
This is all live streaming, which is really important because you want to have that communication back and forth with an expert, because being able to talk to an expert is important for learning.
This is cutting-edge technology that could transform the healthcare industry. And recently, the federal government recognized that. Camels and Imertech have been awarded a $150,000 Small Business Innovation Research Grant from the National Institutes of Health.
NIH grants are very competitive, so that's one of the reasons that we're very excited, because it definitely validates the work that we've been doing.
Over the next few months, they'll study how this 3D virtual reality training compares to typical remote training for emergency medicine physician residents.
If we're able to research and find out that this is actually better than traditional remote two-dimensional training, we're able to now bring training to places that were traditionally very difficult to do, like rural environments.
It would also open the door to more funding, allowing the research to expand beyond medical resident training.
Still ahead tonight, the continuing surge of COVID-19 is colliding with an unseasonable epidemic of RSV, a respiratory illness, and it's landing children in hospitals across the country.
We're seeing many more children admitted who are very sick from this than we've seen at any point prior in the pandemic.
We take a look at the numbers and what health officials are saying about the continuing upsurge of RSV cases.
Here's your local stock market update from Big Fox. Now, your Twin Tiers forecast from Big Fox.
Your Big Fox forecast is brought to you by William Mattar. Good evening, everyone. It has definitely been warm and humid today. This comes ahead of a cold front that seems to be stalled just to our north, and so it will stay up there tomorrow. It doesn't look like it's not going to really slide through until the end of the day or even into the weekend. So it is going to be warm. It will be humid for your Friday, but it's not going to be quite as warm as it was today. And then our rain chances will also increase as well. But our dew points and temperatures will be very close together as we head into the early morning hours. So there will be some fog developing around 5 or 6 o'clock and lasting through about 7 o'clock or so. And then the sunshine will start to win out by mid-morning. However, that cold front I was telling you about will be draped just to our north. Again, it will be humid, and so those temperatures will feel about 5 degrees warmer. There could be a few showers and thunderstorms that pop up along that boundary, and so we do have chances of rain for your Friday and more chances of rain over the weekend. Our dew points right now around 72 degrees thanks to those south winds that have been just streaming that moisture northward, so it does feel very sticky outside, and tomorrow is going to be more of the same, but it's not going to be quite as warm, with temperature readings only warming up in the afternoon to around 84 degrees. We do have the possibility of a few thunderstorms in the afternoon. It will feel like the 90s out there because of that humidity. Our future radar is showing not a lot of activity for tonight, but notice that around 1 o'clock in the afternoon, rain will be moving in from the south, covering many of our hometowns, but then it starts to taper off at around 7 o'clock, and then just a few spotty showers overnight into early Saturday, and our chances of rain will start to increase in the afternoon again on Saturday, and then we have better chances of rain early next week, which will cause those temperatures to be cooler next week. So for tonight, 69 degrees for the low in Elmira, 71 degrees in Corning. Highs tomorrow will be around 84 degrees in Corning, a little bit cooler in Perkinsville at 84 degrees. Your extended forecast calls for scattered showers and thunderstorms for your Saturday, a little bit more sunshine on Sunday, so we warm up to around 88 degrees, and then another cold front finally pushes in, and that's going to bring those temperatures down, a little bit more sunshine by Tuesday. We only warm up to around 80 degrees, but it will be cool for the second half of next week. Our high on Wednesday will only be around 76 degrees. Overnight lows will drop down into the 50s, and it may feel a little bit chilly by Thursday, even though we're going to enjoy plenty of sunshine. Our high only rises up to around 71 degrees. That's a look at your weather. Stay tuned. We have more coming up after this.
It now looks like the first COVID-19 death in the U.S. was earlier than experts had thought. Kansas health officials say a person died of it on January 9th of last year, but doctors didn't know how to recognize it at the time. Bryant Madrick reports on the broader implications of this finding.
Today, everyone is familiar with the word coronavirus. That wasn't the case in January 2020, but apparently it was here and deadly. The Kansas Department of Health and Environment reports a person in Leavenworth County died January 9th, the earliest COVID death on record in the U.S. But what can be learned from that death? For answers, I turned to former KCMO Health Director Dr. Rex Archer, now with Kansas City University.
When a new infectious disease breaks out, there will be deaths before we realize it's in our community someplace. And that's why we have to act very quickly and strongly to put it out.
Archer says going forward, one takeaway is properly funding health departments. He says rapid testing could have been done to detect a new virus. Coronavirus researcher Anthony First says the early death doesn't change how we think of the virus right now, but it does raise important questions.
And so it'd be interesting to see, if you go back to the sequence of the viruses that infected these people, are they the same virus that was originally reported in early January 2020 in China?
Now a new question is being raised. Are COVID deaths underreported?
COVID-19 was probably in the United States before December, and it probably did take lives. And I think that overall, the COVID-19 deaths are underreported.
In Wednesday morning's University of Kansas Health System briefing, Dr. Stephen Stites compared COVID-19 to another devastating virus from our past.
You know, there are a lot of HIV deaths that didn't get accounted for because we couldn't diagnose this, we didn't want to diagnose it, and we didn't have all the testing available for it. And so now the HIV deaths were probably a lot higher, was probably out there a lot longer than we knew, and I suspect the same is going to be true for COVID-19.
The continuing surge of COVID-19 is colliding with an unseasonable epidemic of RSV, a respiratory illness, and it's landing children in hospitals across the country, many of which are already overcrowded. Mandy Gaither has more in today's Health Minute.
It's a collision of viruses overwhelming some pediatric hospitals across the country. First, those battling COVID-19.
We're seeing many more children admitted who are very sick from this than we've seen at any point prior in the pandemic.
On top of that, some hospitals reporting children also being infected with a second virus at the same time, usually a respiratory sickness. The CDC warned doctors last June of a growing number of RSV cases across the South. Data shows a continuing upsurge of RSV now across the rest of the country.
Even though we have, the prospect of the winter coming with increased respiratory diseases, and we saw a lot of spread of coronavirus last winter, there's a big difference between last winter and the upcoming winter, which is that we have millions and millions of people in our country who are now vaccinated.
The Delta variant continues to cause COVID-19 cases to climb. Overall, the latest numbers show more than 100,000 people hospitalized for COVID-19, the U.S. averaging more than 1,100 COVID-19 deaths each day, a 39% increase over last week's 7-day average. Health experts continue to say vaccines are the best protection and also help protect those who are too young to get vaccinated.
I have seen a lot of people change their minds and change their attitudes towards COVID-19 vaccination with how many young people are going into our hospital systems right now.
For Health Minute, I'm Mandy Gaither.
The U.S. economy is doing slightly better than experts first thought. According to the Bureau of Economic Analysis, the U.S. gross domestic product grew at a rate of 6.6% between April and June. It is the best quarterly growth rate since last fall and slightly higher than what economists initially thought it would be last month. They expected to see a growth rate of 6.5%, but were ultimately hoping for 8.5%. Millions of Americans are bracing for an uncertain future when their federal pandemic-era unemployment benefits end in less than 2 weeks. It comes during a time where the end of the pandemic and its economic impact is nowhere in sight. Vanessa Yurkevich has the story.
How are you feeling about September 5th?
Like really scared.
That's been one thing that's constantly gave me anxiety.
The sleeplessness, it's a lot.
One date, September 5th,
will change the lives of these Americans and 7.5 million more. Federal pandemic unemployment benefits, which helped many survive an unprecedented economic crisis, are ending. For Gustavo Maria, the timing couldn't be worse.
My daughter is a couple weeks from being born.
In the last year, Maria says he lost 2 jobs, broke a bone in his leg, and saw the family car repossessed. And in less than 2 weeks, he will lose all unemployment benefits.
My inner voice is me yelling, screaming, trying to be like, what I'm gonna do, what I'm gonna do, what I'm gonna do.
It's a question millions of Americans will have to answer. For Maria, his injury makes his previous $15 an hour jobs working in warehouses painful.
I have this scar in here.
While out of work, he's been teaching himself about computers, hoping he can land a desk job.
Adults just want to be in a warehouse every day, so I'm trying to better myself.
There are a record 10 million job openings in the U.S., with millions still looking for work.
It's frustrating because, yeah, there are any number of jobs that I could go out and do, but not all of them can support me.
Michael Kittle, a Broadway graphic designer, has been out of work since last year. He says he applies to 50 jobs a week, but still waiting for a callback.
It's been rough.
If he still doesn't have a graphic design job come September 5th, he says he'll pick up shifts at a restaurant.
Why have you not chosen to do that before?
Because we're still in a pandemic. The idea of being close to hundreds of strangers a day, even while being vaccinated, that's not something that appeals to me in any way.
Cutting aid doesn't necessarily mean people going back to work. Between April and July, states that ended unemployment benefits early saw a nearly 1% jump in overall job growth. But those states that kept them in place saw job gains of 0.5% more.
My dad, my mom, upstairs I have, my sister.
Giselle Manzano provides for her large family. Since she lost her banking job earlier this year, savings and unemployment has kept the family afloat. She's about to lose a crucial extra $300 a week in benefits.
I thought I had everything covered, and then savings are gone. There's no retirement money. My life insurance policies set up for the kids as well as myself, it's gone.
Slowly.
Careful.
Despite the physical pain of working on his feet 8 hours a day, Maria says the financial pain without unemployment is worse.
Would you go back to a job, like a warehouse job, just to be able to provide?
I won't do any type of job that need to do along it's providing for my family.
We want to leave you with a smile tonight. Move Over Dalmatians. It's the little baby pig who's taking the spotlight at one New York City firehouse in Brooklyn. Check out this cutie. Penny the Fire Pig is 3 months old and was adopted by FDNY firefighter Darren Harris. Penny spends much of her time hanging with Dad and the other firefighters at Engine 239 in Park Slope. She's become somewhat of a local celebrity, many stopping by to snap pictures with the cutie and feed her snacks. Harris says Penny will likely be about 50 pounds when she's fully grown. As Dad and the other firefighters, well, they've changed up their diet and are no longer eating pork around the firehouse. Thanks for joining us. Have a great night.